Hello, I am Dr. Sauren Panja. I am working as Senior Consultant and Head Department of Medicine and Critical Care Medicine at R N Tagore Hospital, Kolkata. Right now, I want to discuss couple of minutes about the antibiotics resistance and its impact in the future. If I talk about the antibiotics resistance, before that I just want to talk few words about the antibiotics uses. In the last couple of about 40 to 50 years, we have seen that the antibiotics we are using for different kind of infection, may it be in the throat, in the chest or in the abdomen. But once we are using these antibiotics, there are a lot of good effect because we are ultimately getting cured from that antibiotics. Because of the antibiotics uses, we are getting cured from that any kind of problem. But side by side, what are the bad effects that antibiotics can create? If we talk about the antibiotics, what are the bad effects is basically, the bad effects is that once we are using the antibiotics for that particular problem, ultimately what will happen, there are other good bacteria in the body, and not only that, during the time when we are using that antibiotic, our other bacteria inside body, they actually try to basically overcome or try to sustain from that odd environment. That can lead to their survival, and somehow they change their molecular or the cellular level so that they can basically escape from that antibiotics effect. Because of that, they ultimately, some of the bacteria get resistance to the antibiotics, and these bacteria, if they cause infection to the other's body or in the own body, so then that will be antibiotics resistance bacteria or germs. And not only that, once we are using one particular antibiotics, somehow our body system or the body bacteria, there are good bacteria, they also try to change themselves, and when there is any infection that happen in the subsequent period, they may be antibiotics resistance with not only with that particular antibiotics, sometimes they may be antibiotics resistant to other classes of antibiotics also. And if we talk about the what are the reasons that there is so many or the such good number of the antibiotics resistance that has happened in the couple of years. So if we see that antibiotics has not been used in the only human body, there are antibiotics used in the veterinary practice as well as in the poultry industry. They have used too many antibiotics, and the some of the antibiotics has been used just to basically give a good growth potential in the poultry animals. So because of that uses, so all these bacteria, they are ultimately, some of the bacteria is getting resistance and they are coming in the environment, and from that environment we are picking up some infection and we are getting antibiotics resistant infection. That is a real major threat. And not only that, in the last at least 4 or 5 years, we have seen there are practically very few antibiotics left that sometimes we use in the critical care unit, because most of the common uses antibiotics that used to be, so they are not at all working right now. So that is really a threat to the society. So if I talk about how can we avoid this antibiotics resistance, so antibiotic resistance we can ensure by taking first foremost thing that we should be a bit educated, so that we can know how to basically prevent this antibiotics resistance. For that, basically what I will suggest, before taking antibiotics, we should know whether this antibiotics at all is necessary in our body or not, because there are certain viral infection, throat infection, for that there is no antibiotics necessary, but still we sometimes take antibiotics from the over the counter from the shop, and we take these antibiotics for 1 or 2 days, then we stop it. Ultimately, because viral fever, automatically it gets cured, but this antibiotics, what it harm it will cause, some of the bacteria inside body will be resistant. And not only that, along with that, sometimes we are taking antibiotics before, rather than taking 5 to 7 days course, we used to take only 2 to 3 days, then we automatically stops in our own. So that is also not good. So we should be very cautious about it. And second thing, I will always suggest, before taking antibiotics, rather than going to shop and taking over the counter medicine, we should go to the respective doctors and take consultation per doctor, so that we can come to know whether this condition needs at all antibiotics use or not, what is the particular course, as well as how the antibiotics should be taken, whether this should be before food or after food. That is also important, because that antibiotics work because of the bioavailability. In medical term we call it as bioavailability. That is also important. So for that, these things should be necessary, and this is the high time when we should be very cautious about using antibiotics. Not only that, before taking antibiotics we should have a bit of knowledge about the antibiotics uses. And then we should be not only be conscious amongst ourselves, we should also share our knowledge with others also, so that the whole of the environment as well as our surrounding areas, the population at large, they are also a bit should be knowledgeable about the antibiotics uses and its misuses. So this is high time we should act, otherwise in near future there may not be any antibiotics that will work in future. So that is very important, and the message is that we should be right now cautious about using antibiotics and we should be alert. So with these few words I will say that we should act right now.